So, hello friends, welcome back to my channel Medicine of 101. How are you? Hope you all doing good. So, let's continue today's topic. So, we'll talk about today lung mechanics. So, from the physics, the term is quite familiar. Mechanics means definitely there should be some, force related something. In the same way, we'll get also over here that lung mechanics in a nutshell, in a what we can say, the forces that will help to take the air in and to take the air out. Okay. So there are certain types of the factors, so the certain types of the forces that will help to take the air within the lungs and to take the air from the lungs to the outside. Okay, so let's write it over here that lung mechanics means we can write it over here that certain kinds of the forces or the factors that will help to take the air in terms of the lungs, within the lungs, and take take the air out outside the lung. Okay, now we'll talk about those types of the forces and different aspects related to this topic. Okay, now before starting the topic in details, let's familiar with certain types of the muscles that help in during expirations and inspirations. So see, I'll use the term inspiration that also means inhalation, inspiration that also means inhalation, and expiration that also means exhalation. Okay. Now see, if we just say under normal circumstances during under resting conditions, if we see in terms of the breathing, in terms of the inspiration, so what we are going to get over here during or resting conditions, or you can say quiet breathing. If we talk in terms of the inspiration, which muscles that will be involved over here? Definitely what? Which muscles? Yes, you did correct. That is the diaphragm. That will be the diaphragm over here. So, diaphragm, that means this muscles over here is the diaphragm. Okay. Now, let's talk about under there is certainty of the conditions. For example, you are in a hurry, so maybe you are doing exercise, or maybe a dog's run after you. So definitely at the time you have to what? You have to go first. So at the time your inspiration that should be increased, just like this. So definitely at the time the diaphragm that will be not enough to do the inspirations over here. So during exercise or during this type of the conditions where you need to do the more amount of the inspirations. So during exercise, for example, I'm writing it over exercise. Okay, what type of the extra muscles that will be involved over here? The muscles that is what? External intercostal muscle. So we write it over here, external, okay, intercostal muscle. We'll show over here, okay, and step by step I'll show you all the things, okay, through the by presentations I'll try to understand you guys. So external intercostal muscle. Okay. Now if we talk about in terms of, for example, the expiration, normal what do you do? Expiration is it what? Do we need to use any type of the muscles for expirations? No, we don't need to use any kind of the muscles during expirations, because expiration is the what? Is the passive process. So definitely we are not going to use any kind of the muscles over here. So during expiration it's a passive process, so we are not supposed to use any muscles. So if I write it over here that quiet expiration, so quiet expiration, in this case it's the passive process. The passive process, we are not going to use any kind of the muscles. But the same thing, if you are in hurry, okay, the same thing, you are doing exercise or you have to run fast, at that time what type of the muscles you can use? So for example, during exercise you need to exhale more and more. Okay, let me use this one over here. Exercise. In these cases, we'll use what? Internal intercostal muscles. We'll use internal intercostal muscle. Internal intercostal muscles. Another important muscles, that is what? rectus abdominis or abdominal rectus muscle. Okay, so you can write it over another, that is the rectus abdominis muscle. Because see, whenever we are talking in terms of the rectus abdominis muscles, for example, this one, inside, whenever you are doing the expirations, this what? This rectus abdominis muscles from here, it will just push, it will push back what? The diaphragm. Whenever the diaphragm will be pushed by the what? Rectus abdominis muscles, we can see easily that what? Definitely the volume of the lungs that will be less. As a result, it will be easier for the lungs to do the expiration. So, we got over here that rectus abdominis muscles. And during exercise, one more muscles you can remember over here, that is sternocleidomastoid, sternocleidomastoid muscle, that will help during inspirations. Okay, during exercise. Now we'll talk about the mechanisms for these things. Okay, so what type of the mechanisms we'll get? We'll get two types of the mechanisms. For that thing, I have to show you a little bit of this part. So let's over here. Okay, let's make it large. Okay. Now see, for example, definitely we have to talk in terms of the ribs. Ribs are definitely, what do you know? Definitely in the front, what? They are connected with the sternum. And in the posteriorly, anteriorly they are connected with the sternum. And posteriorly they are connected with the vertebral column. So if I just say, the vertebral column over here, and is the sternum, okay. Now we'll see the ribs, they're attaching in this way. Okay, and they are connected with the what? Posteriorly with the superiorly. Posteriorly we'll see that they are what? The superior, they are connected superiorly. Anteriorly they are connected with what? Sternum, that will be inferior. Okay, I'll show you with the diagram. Okay, let me use this part first. So in this cases we'll get this way. Okay, just like this. Okay. Now try to understand from here. Let me show you first with this one. I want to say you in this way that, for example, is the sternum. Think it's the sternum. Okay. Now is the ribs. These are the ribs. The fingers of the ribs. And for example, this is the what? This is the vertebral column. Now the ribs are connected posteriorly and the what? Superiorly with the vertebral column, and the ribs are getting connected with the what? Sternum, anteriorly and inferiorly. So if I say the position will be just like this normally. Try to understand from here, the position will be just like this. Okay. Normally. Now whenever you are saying in terms of the inspiration, when you are talking in terms of the inspiration, at that time what the muscles will do, for example, if we just say in terms of the diaphragm and the external intercostal muscles over here, they will lift upward, the ribs. So whenever the ribs, try to understand, these are the ribs. Whenever the ribs they are going upward, as a result, what type of the thing you can see over here, if you just try to understand the transverse diameter, that will be increased. So whenever they are getting upward, whenever the ribs are what? Lifting upward, so normally under resting conditions the ribs are in this way, okay, in these positions. Whenever the muscles they are what? Lifting the ribs upward, as a result we will see there the transverse diameter that will be increased. Okay. So this type of the movement, what? This is the buckle handle movement. This type of the movement is known as buckle handle movement. Bucket handle movement. Let's write it over here. So what type of movement we will get over here? During inspiration, we will get over here bucket handle movement. In these cases, I have already showed you that the transverse diameter, okay, the transverse diameter that will be increased. So the transverse diameter, that will be increased. As a result, you will see the volume of the lungs, that will also increase. As a result, we will see more amount of the air that will be taken by the lungs. So more amount of the air that will be taken by the lungs. Now the rest, another mechanisms. Okay, let me show you over here. In the same way, see, These are the ribs. They are connected what? They are connected posteriorly with the vertebral column, anteriorly with the sternum. Now try to understand from here, when we are saying in terms of the, this is the movement. This is the movement where we are getting what? The backhanded movement. In the same way, we will see these muscles, they will also, they are also able to take the sternum. This is the sternum. They are able also to take the sternum upward, just like this. Normally in this way. After that, we will see in this way. Normally in this way, okay. But the muscles are also able to take the sternum upward. Whenever the sternum is going upward, and also it will be what? Moving forward. The sternum that will go upward and moving forward. As a result, this, this distance, that means the diameter, anterior posterior diameter, antero postero diameter, that will be also increase. So this type of the movement, see, whenever the sternum is moving upward by the help of the muscles, as a result we are getting anterior posterior diameter, that is also getting increased. So this type of the movement, what? This type of the movement is known as palm handle movement. Okay, palm handle movement. So the next thing we are talking about palm handle movement. So palm handle movement. In these cases, we will get the antero postero diameter, that will be increased. As a result, the lung volume, definitely that will be also again increased. And whenever the lung volume increase, more amount of the air that will come within the lungs. So definitely we are getting what? Now try to understand, we are getting in this way. Try to understand this diameter, that means antero-posterior diameter, that is also getting increased. Along with that, what? The transverse diameter by the what? Bucket handle movement, that is also getting increased. Now ultimately we will see the volume of the lungs that will be increased. So this is the mechanisms of the different kinds of the the process by which we can say the volume of the lungs that will be increased over here. Now we'll talk about the different kinds of the pressures over here. Okay, we'll talk about different kinds of the pressures. For that thing, let's talk about from here. Now, when we are talking in terms of the different kinds of the pressures, we have to know, because these things are very important. Whenever I'll just show the graph, at the time you will not be able to understand if you don't know the pressures. So make sure that you are listening to me very carefully. Okay. Now see, I have already drawn over here the diagram. Now see, this is definitely what I'll just show with the red color over here. See, this is the what? This is the alveolar. So I'm writing it over here. This is the alveolar over here. This is the what? Pleura. Now see, within the pleura we'll see this is the pleura inside the inner layer of the pleura, that is known as what? Visceral pleura. That is getting attached within the what? That is getting attached within the lungs tightly over here. Okay. In the same way, we'll also see over here the visceral pleura that will get attached with the lungs tightly over here. Okay. Number 2, this is the within the pleura. Okay, the pressures, and this is the outside. This is the chest wall. This is the chest wall, and within the chest wall, these are the ribs. These are the ribs, and within the ribs, what? The muscles are getting connected over here. These are the muscles. Okay, they are connected over here. Now, first thing first, the first pressure, number 1 pressure within the alveolar, that is known as what? That is known as intra-alveolar pressure. So this is known as intra-alveolar pressure. Normally within the alveolar, definitely the pressure should be called as intra-alveolar pressures. So let's write it over here. Number 2 within the pleura. So number 2 within the 2 pleural layers, we are getting the pressure. Definitely we are going to call it intrapleural pressure. Intrapleural pressure. And number 3, outside what? Outside the chest wall, within the, we can say in these positions, definitely whatever the pressure we are going to have, definitely it should be the atmospheric pressure. It should be the atmospheric pressure. So number 3, you have to talk in terms of the atmospheric pressure. We can say thoracic pressures, or we can write it over here, intrathoracic pressure. Or we can say atmospheric pressure, because this type of the pressure that is also present in the outside, I mean outside the lungs, in the environment. So atmospheric pressure. Okay. Now one more term that should be very clear to you, that is known as transmural pressure. Okay. Okay, let's use this one over here. Now I'm just highlighting star marking with this one, that is known as transmural pressure. Transmural pressure, that should be clear for you, very okay. Now see, whenever you are talking in terms of the transmural means what? Across the wall. So whenever you are talking in terms of the pressure across the wall, definitely that should be known as transmural pressure. Okay. So this type of the thing will get across the wall. Across the wall. Now I'll just show this diagram. Okay, I'll just take this part. Okay, for you guys. So let me draw once more over here. Okay, let's make it large. Okay, think is the alveoli. Okay, the alveoli over here. After that we'll get what? I'm just taking this alveoli, and after that I'm taking the pleural membranes over here. Okay. Is the visceral pleura. After that we'll get what? We'll get the parietal pleura. Okay. And after that we'll get the chest wall. We'll get the chest wall. For example, I'm just taking the chest wall in this way. Okay, this is the chest wall. And for you, okay, let me show you the ribs. These are the ribs. I think I had to draw the diagram before, only then I could save the time at least. Anyway, let's continue. Okay guys, okay. Now see, let's make another layer for it. Okay, in this direction. Okay, now see. First, the first thing first we'll talk about first the what? This is the first pressures within the what? Within the alveoli, is the intra-alveolar pressures. Now this type 2, that means if we just talk about over here, if we talk about this one in terms of the pleura, so we'll get the intrapleural pressures over here, and okay, let's make the pleura in this way. I'm just taking this the intrapleural pressures, okay, and outside these things, here we'll get what? Thoracic pressures over here. Okay, so let's write once more again over here. If I just say, try to understand this part got raised, so let's make it more clear once. The number 1, this is the intra-alveolar pressure. Number 2, this is the intrapleural pressure, and number 3, what? We are getting the intrathoracic pressures over here. Now see, when you are talking in this, so you are getting how many walls? First, if I just say that across the wall, so definitely if we can talk in this way, that in between the what? Pleura and alveolar. So we can get the transmural pressures. We can get the transmural pressure across the what? Pleura and alveoli. Okay, so this type of the transmural pressure, that is known as what? Transpulmonary pressure. Good. This type of the transmural pressures across the, in between the alveolar pressure and the intrapleural pressure, that is known as transpulmonary pressures. So we can write it over here. We'll get in between 1 to 2 this type of the pressures, that is known as transpulmonary pressures. Transpulmonary pressure. Now try to understand from here. If we get the transpulmonary pressure, if we get the transpulmonary pressure that is positive, definitely the lungs that will what? Inflate. And if we get the transmural pressure that is negative, definitely what? The lungs that will deflate. So if we write it over here, okay, let's write it once. Transmural pressure, sorry, the pulmonary pressure. Transpulmonary pressure, if we get it's positive, definitely what? The lungs that will inflate, that will expand. And if we get the trans pulmonary pressures, that is negative, the lung that will deflate. Okay, and if we get the trans pulmonary pressure that's equals to 0, definitely there will be no net change. No net change over here. Okay. Now I'll talk about the second kinds of the transmural pressures across the. Okay, let's show the red color only. If I say across these two, that means in between the intrapleural and thoracic. Okay, let's do it over here. So let's use this one. Now we'll talk about the two types of second transmural pressures, that is across the what? Across the intrapleural pressure and atmospheric pressure. The outside of the chest, that is what known as atmospheric pressures. Now this type of the pressure, that is known as transthoracic pressures. So transthoracic pressure. Transthoracic pressures. Okay, from what? 2 to 3. Okay, in the same way, if we get it positive, then what? It will expand, the chest will expand. If we get it negative, then definitely the chest will what? Deflate. Definitely the chest that will be not expanded. It will get deflated, okay? Now in the same way, if I just say over here that, transthoracic pressure, if we say the positive, we'll say what? Chest that will expand. If we get the transthoracic pressures, if we get negative, then chest that will what? Deflate. And if we get transthoracic pressure, that there is 0, no net change. We will not get any kind of the change within these things. Okay, so it's clear now. Another type of the pressures we are going to talk right now. If I just consider from inside of the alveolar to the outside of the chest wall, this type of the pressures we are getting what? From here, from the in between the what? Alveolar and the what? Chest wall. Now this type of the pressure, that is known as transrespiratory pressures. So that is known as transrespiratory pressure. Let's use the different color. Trans or respiratory pressure. Transrespiratory pressures. Okay. Now see transrespiratory pressures from what here? From 1 to 3. From 1 to 3. Okay, in this way. Now this thing is known as transrespiratory pressure. In these cases, we are talking in terms of the lungs. We are talking in terms of the what? Chest wall. If we get this positive, if we get the transrespiratory pressure positive, definitely what? In these cases, we will get, there will be expanded. There will be what? There will be inflations. There will be inflating. There will get inflated lung as well as inflated chest wall. If you get negative, there will get deflations in terms of the lung as well as in terms of the chest wall. If you get 0, there is not a net change. Okay, there will be no net change in terms of the lungs as well as in terms of chest wall. Now we'll talk about some equations. So how can we represent these things? Okay, let's talk about this first. Now see, when you are talking in terms of the transmural pressure, that means pressure inside wall minus pressure outside wall. Pressure outside wall. Okay. Now, if I just talk about for the first things, transpulmonary pressure. So, if I say write it over here, the transpulmonary pressure. What can you write it over here? The pressures, that means intra-alveolar pressures. Okay. Intra-alveolar pressure minus, what can you write? Intrapleural pressure. Now, try to understand during when you are talking in terms of the intrapleural pressure, that will be always negative. I will say why. Intrapleural pressure, that will be always negative. Why? Try to understand. When you are talking in terms of the expansions, we are talking in terms of the inflations. At that time, try to understand from here. This chest that is trying to what? Expand. This chest that is trying to expand. In the same way, what for we know that the lungs, they are having the elastic in nature, they're elastic in nature. As a result, they will try to recall, they will try to come back in their own positions. See, the lungs is trying to, for having the elastic tissue, the lungs is trying to come back, and the chest wall, that is trying to what, expand from here. So as a result, it is trying to expand, it is trying to come back from here. As a result, in these positions, we'll get what? We'll get definitely, we'll get what? The negative pressures. I'm repeating once again. The chest wall is trying to what? The chest wall is trying to go away. In the same way, the lungs is also trying to come back. Because of what? Because of having the elastic tissue. The lungs is trying to come back to its original position. The chest is trying to go away from its positions. Now, as a result, in between these two, we'll get in the pleura, we'll get the what? Definitely the negative pressures. So, and intra-alveolar pressures, whatever the pressure that is present within the what? Atmospheric pressure, that will be within the intra-alveolar pressures. So, we can write it over here, we'll get 0, minus. And why I'll get the negative pressure where I definitely have said, for example, if we get minus 5 centimeter of water, then ultimately we'll get 0 minus plus 5, will get 5. So we'll get positive, we'll get the positive pulmonary pressure. As a result, we can see there will be deflations, there will be inflations of the lungs over here. The next one we will talk about in terms of the transthoracic pressures. So transthoracic pressures. So let's erase this part. So if we say transthoracic pressures, transthoracic pressure. Now how can we define this one? Transthoracic pressures means across the what, this wall. So definitely the pressures within the what, within the pleura. That means interpleural pressures minus what, atmospheric pressures. So we can write it over here. The pressures within the intrapleural minus atmospheric pressure. In these cases, we can write intrapleural pressure minus atmospheric pressure, definitely that will be 0. So we can write the transthoracic pressure, that's equals to intrapleural pressures over here. Okay, this thing we can write it over here. Now we'll talk about respiratory pressures. So let's use this part. I will talk about respiratory pressures. What can we make over here for this thing? Okay, let's use the red one. So respiratory pressure. Respiratory pressure means across this line. Try to think the inside of what, intra-alveolar pressures, outside of what, the atmospheric pressures. So you can write it over here that pressures within the what, intra-alveolar pressures minus atmospheric pressure. This we can write it over here. So these are the equations as far as the transmural, different kinds of the transmural pressures are concerned. Okay, we'll get the 3 types of the transmural pressures. We'll get transpulmonary pressures, we'll get transthoracic pressures, we'll get transrespiratory pressures. Okay, now we'll talk about the 2 important things, the 2 important characteristic features of the lungs. One is compliance and another is elasticity. So before studying that one, let's okay, let's continue. So last time I did talk about up to this much. Okay, the different kinds of the transmural pressures. Now we'll continue about that the 2 kinds of the features of the lungs. One is known as what, the compliance, and another is known as elasticity of the lungs. So for that thing, I need to erase this part. Okay, I need to erase this part, guys. Let's erase this part. Let's erase also this one. So I think the concept of the pressure is clear to you guys. Okay. Now we'll talk about 2 types of the features of the lungs. One is known as compliance, and another is known as So compliance, and another is known as elasticity, elastance. These 2 types of the features of the lungs should be clear to you when you were teaching when you were learning the respiratory physiology. Okay. Now For that thing, I'll take the two rubbers. In this case, if I want to make sure that you are understanding well, I have to give some examples for you. Okay, I'm just taking the two rubbers. The two rubbers. One rubber in this way. Within the rubbers, definitely, if you try to stretch out, it will come back again. These are the elastic tissues, for examples. These are the elastic materials. I'm taking another elastic tissues in this way. Here the elastic natures will be more. Try to understand the thick rubber and the thin rubber. See, I'm taking the first things. I'm taking what the first thing. Okay, let's talk about it. And the first thing I'm taking in terms of the thin rubber. In number two, I'm taking the thick rubber. Now try to understand from here. Okay, if I try to number one rubber, if I try to stretch it out, if I try to stretch the number one rubber out, then definitely what it will try to come back to its normal positions because of what it is having the elastic natures. In the same way, if I try to stretch out the rubber too, definitely what it will also try to come back its normal positions. Now see, if I compare in between these two rubbers, definitely rubber number one that will be easier to stretch out because it is having the less elastic tissue. Definitely as a result, the less elastic nature we will see over here. So the chances for the recoiling that will be less with compared to number two rubbers. Okay. So if we say if we can stretch it out easily, definitely it is having the more compliance. So compliance that is explained in terms of this thing, that is stretchiness. So if we get the more stretchiness, so measure of stretchiness we can write. Let's use the different color. So yes, measure of stretchiness. In this case is, so number one rubber, that is what more compliant. The compliance property will get in number one more. In the same way, if I say that definitely what this will be less compliance. Now try to understand from here that how can we just measure the compliance in mathematical equations. Definitely what you can write it over here, that number one, if we just say number one is having more compliance, number two is having less compliance because of what, having the more elastic tissues or more elastic materials over here. Okay, and if we say in compared to elastance property, if I just say in terms of the elastance property, whatever the thing we'll get over here, definitely number one, try to understand number one tissue, sorry, in number one rubber over here. In number one rubber, definitely the less elastic material is over here, so we will get what, less elastic properties, so we'll get the less elastance. In number one we'll get the less elastance. In number two, there is more presence of the more elastic tissue, definitely the elastance that will be more over here. Now try to put over here the alveoli, then it will be easier for you. Definitely here is also what, the presence of elastic tissue within the lungs. We know there is a presence of elastic tissue. And the same way, if I just put the alveoli over here, there is also presence of what, elastic tissue over here. Now try to understand from here, it is very important. Okay, if we say that the lungs are basically elastic in nature, now if we see there are certain types of the disease where we are getting the elastic destructions, the elastic tissue are getting destroyed. Definitely in that cases, if we see any kind of the disease where the elastic tissue of the lungs are getting destroyed, definitely in that cases we can say the lung is more compliable. The compliance property of the lung, that will be increased. In the same way, if we see that for any kind of the disease, if we see within the lungs the fibrotic tissue, that means the elastic tissue are getting more and more, definitely the lung that will be fibrotic. Okay, so if we get the fibrotic lung, definitely the elastance that will be more, that will be what we cannot stretch the lung. If we just try to stretch the lungs, in the fibrotic lung, we are not do so easily. It will come back to its original position again and again. So by the mathematical equations, if you want to represent of these things, the compliance is represented in terms of the change of volume by change of pressure. So change of volume by change of pressures. Try to understand from here. If I just make it large, if I want to make it stretched more and more, by doing it, if I want to make by just changing a little pressures. For example, I'm just changing the pressures over here, 2 centimeter of water over here, for example, and I'm also doing the changing in the pressure over here, the same 2 centimeter of water. definitely in the number one cases we will get the more volume. Because we will get the more stretchiness, we can just make the number one rubber more stretchable because it is having the less elastic tissue. Definitely the volume that will be more. So in number one case, the compliance that will be more. So definitely the volume that will be more over here. But compared to these things, if I add it over here, the compliance of these things, what? The delta V by delta P. If we just do the same pressure change, the volume change that will be less because of having the elastic tissue over here. Okay. Now we'll talk about the different kinds of the compliance of the lungs over here. At first, the first thing first, if we compare the lung compliance, so first we'll write it over here, the lung compliance. Lung compliance we can represent in this way that, see, that's equals to delta V by delta P. Delta P means the what? The definitely it will be the change in pressure in between the what? Alveoli and pleura. So it will be the trans pulmonary pressures. So you can write it over here that we'll get in terms of the lung compliance, we can write it over here, change in volume of the lung by delta P. That means what? We can write it equals to pressures within the intra-alveolar pressures minus pressures within the pleura. So intrapleural pressures we can write in this way. Now if we say the compliance of the lungs is done, now if you talk about in terms of the compliance of this part, okay, let's use this one for it. Okay, let's use this part over here. Yes. Now this is the compliance of the lungs. So let's write it over here, the compliance of the lungs. Now in the second part we will talk about the compliance of the chest wall. If we say the compliance of the chest wall, definitely you have to use the same formula. We can write it over here, delta V by delta P. That means change in volume of the chest wall by transthoracic pressures, because it is approaching the what? Chest wall. So we have to write in terms of the transthoracic pressures. So we can write it over here that we'll get over here what? Delta V by delta P. Now this delta V that will be equals to what? The pressures within the intrapleural pressures minus pressures that will be what? Atmospheric pressure. Okay. Now we'll talk about the compliance of the respiratory systems. When you are talking in terms of the respiratory systems, you have to consider the pressure in terms of the trans-respiratory pressures across the what? Across the alveoli and chest wall. Sorry, across the alveoli and outside the chest wall. Okay. So if I write it over here that compliance of a respiratory system over here. Okay, let's use this color over here. If I say that compliance of the respiratory systems over here, we can write change in volume divided by change in pressures. Now these pressures we can write in this way. Definitely that will be pressures intra-alveolar pressures minus pressure, that is what? Atmospheric pressures. So this will be the compliance of the respiratory systems. Okay. This will be the what? Compliance of the lungs. This will be the compliance of the chest wall. Now if we say in terms of the elastance, what type of thing we'll get over here? Now the elastance that is represented in terms of the opposite things, the reverse things. So let's write it over here. If we write in this way, that elastance we can measure in this way, that change in pressures by change in volume. Now see. Try to understand from this figure. If I try to make, for example, if I want to make it 1 more centimeter, enlarged. If I want to increase the volume of this 1 meter more, definitely the pressure I have to apply less with compared to this one. Definitely the pressure I have to apply over here to increase 1 centimeter volume of this one. I have to apply the pressure less with respect to this one. But if I want to increase the volume 1 centimeter cube, 1 centimeter cube for this one, definitely the pressure I have to apply less. But if you want to increase the 1 centimeter cube volume of the first rubber, definitely I have to apply the pressure more and more. As a result, we can say the pressures and the rubber number 2 definitely have to use the pressure more and more. So we can say in this case is the elastance that is more. But if I just compare with this thing, try to understand from here. If I say the elastance for the number one rubber, definitely delta P by delta V. If I want to increase the volume, definitely the pressure I don't have to use that much pressure. Definitely we'll say for the number one rubber, the elastance that will be very very less, not that much with compared to the with number one, number two rubber. So number one, in this cases we can say number one rubber that is having the what less elastance, because if you want to increase the same volume with compared to the number two rubber, have to use the less pressure, have to apply less pressure. So this was all about in terms of the lungs mechanics part on. In the next video we'll talk about the different kinds of the graphs we can represent by putting these values. So I'll see you in the next video. So if you think this video is helpful for you guys, please do like and subscribe my channel. And see you in the next video very soon. And please do teach and whatever you can say. Yes, subscribe. And if you don't understand or if you think something is wrong with in my teaching, just please let me know. Or if you don't understand any point related to this concept, then please try to let me know in the comment section. So I will be there to help you guys. See you in the next video soon. Thanks for watching once again.